vascular access devices, or that tools or devices that we use it in the hospitals for administering medication, fluids, and other substance to patients, depends on their own type of care. This, in fact, was a big achievement in the healthcare. So it's lead for a lot of benefits for the patient, proper way of treating, able to communicate directly with the bloodstream, give the substance to the patient and deal with him. However, there are some impact or problems can happen from these devices, such as the infection, thrombus, whatever. So we are going now to clarify these things and discuss it in the infection control viewpoint. The definition for this vascular access devices is a device that is inserted into blood vessels to allow the delivery of fluids, medication, and other substance as we described. What are the types of these devices? We have the CVC, or central venous catheter, which is type of the VAD that inserted in the large vein in the chest to neck, groin, whatever the types. There are different types. All considered under central venous catheter, portocath, and so on. And we have the PICC or PICC, a peripheral inserted central line. It's started from the arm or leg and it's ended by large vein on the chest. And there are what we all know, the peripheral intravenous catheter or PIV, which is what we call it here, the cannula. You know, this is an example of the PICC. The term of cannula, just on for your information, it's come from the Latin origin, which means the little reed or a small tube. And it can be defined as reed or tube, and usually this is used in the healthcare to refer to the peripheral IV line. Okay, so we say IV cannula. And in fact, IV cannula can refer for all vascular access devices, and this is what commonly used. This is example for the central venous line, which is inserted in large vein, and it had its own tip, and there are like in a plastic tube, a part of it inside the vein, part of it outside, and this is the way of communication and dealing. This is like in a big line, which is already start from the arm or leg and end in the major vein. Based on the literature, several studies examine the complication of the VAD in the hospitals. These complications can include infection, thrombus, mechanical problem, dislodgements, and the most significant part is the infection itself. So it's associated with long list of infections, started from the local, signs and symptoms of the infection, and can be ended by the sepsis. Based on the study by Rosenthal, 2014, he recorded in his study for 11% of the healthcare associated infection related to the central line or the VAD, central venous catheter. This is also apart from the signs and symptoms of the infection can happen with the PICC line. This is also with the IV line or cannula, peripheral line. You can see here the signs and symptoms of this infection on the skin, discoloration, redness, pain, all signs and symptoms of infection when it comes to the peripheral IV line. The second problem related to the IV kind is the thrombosis. So based on the studies, we are recording around 2.1 of the central venous line and 1.7% of the PICC already report thrombosis. What is this thrombosis? It's formulation of this clot, and this clot can swim inside the blood circulation and can lead to serious complications such as pulmonary embolism or any other problems related to thrombus. It's thrombus formation. okay? But it's much more affiliated or connected with the vascular access devices, okay? Also, this is a example for how it looks like, the thrombosis, because the nature of the vein, the nature of foreign body inside, and the nature of the wound, the body will start to react in a way would like to get closing to this open. Sorry. Mechanical problems can happen from this line as apart from moving inside or making an injury. In one study, the peripheral IV access record around 35% of the peripheral IV line associated with mechanical problems related to even injury for the inside wall of the vein and other complications. This has happened also for the peripheral and central venous access devices. One of the most famous problems, the dislodgements, which is already happening from dislocation or removal, which lead for what we call it like penetration, infiltration, when the IV line start to get the solution or the substance outside the vein, or the vein wall itself is already damaged, so it start to inflate or make leakage for this material. And also, as we know, that dislodgements from the IV line can be by accidentally removing of the access. You can see here an example of the dislodgements and the infiltration, that there are a kind or substance already escaped from the vein related to something, regardless of why. Maybe it's related to the medication itself, related to the cannula, but at the end, the problem associated with the VAD or the device, the vascular access device. There are a lot of challenges faced the healthcare staff related to the vascular access devices. Started first by the selection and the insertion. It's apart from the very important skill, I think, for the nurses and doctors who already study the insertion of the cannula. It's challenging tasks, and it's very hard to say that you are skillful. Even for the skillful people, they're still facing a challenge in inserting in a proper way for the device, either for selecting the vein, the way of entering inside the vein, the way around the patient during the time of insertion. And we should remember that the condition of the patient is not optimum, right? Because he's a patient, he's in need for this device, so his health condition is challenging, right? So this is all add further or additional challenge for the staff during inserting of the cannula. And this is, I think, what we know. The profession must consider all these factors: the medical history, the psychology of the patient, the type of treatment that already required. Not all treatment can be delivered in the peripheral line, right? There are like chemotherapies or other toxic materials need a large vein to get the proper impact and reduce the complication that can happen from inserting special type of medication, and also the capability or the ability of the vein to keep this access inside. So if the patient gets a chronic treatment, we will be in need to change the location of the cannula several times, which lead for impact on the quality of life for the patient. Sorry. Maintenance and monitoring, of course, it's also challenging, and the challenging coming from this one, as apart from how the maintenance and monitoring will be done and the compliance of the people for making this maintenance, okay, regarding to the dressing change, to know exactly what are the signs and symptoms when already seen, so the healthcare provider have to make an intervention to remove or make the dressing change or change the way of management or dealing with that one. The third challenge is related to the patient education and involvement, and not all the patient aware about this device, the nature of this device, what and how they can deal with this device, and why this device is important for them. So this is also challenge for the healthcare providers, how they will deliver this simple information that we are discussing now in our perspective as healthcare providers to patients, how they should take care of these devices. And the patient also must be involved in their care as a part from the patient rights, including reporting any issue or adhering to the instructions. The one who can report the pain, the discomfort. So this is what the patient will tell us, and this information will come to us based on what we already informed the patient that he should report. So we should be aware about this and how that can happen. However, our concern here is the infection control. So the infection is the main complication. So infection as a main complication for the VAD, it's challenging way and important for us here to look for it and understand that VAD is part from high risk ports for the infection, because we already go direct to the vascular, right? We go direct to the center of the body, to the blood, and it's open access, so it can penetrate or given a route for the bacteria to penetrate and come inside. And there are a lot of complications can only associated with the infection that come from this port that we already opened for the bacteria and lead for complication. So the doctors, nurses have to take in a proper techniques. Healthcare providers all should have a proper preventive measures to prevent this from happening, such as hand hygiene, sterile technique, and minimizing the infection. And the second part, and this is very important, that the healthcare providers should aware about these signs and symptoms. So they should have more or proper information about what are the signs and symptoms associated with the patient in this condition, such as the fever, swelling, pain, right, the inflammation. Even we are discussing this one as they or no, or take it in classes or so on, but in fact this is not always the right. In one study lately published by doctors in Gaza, and we hope that they will survive, and we don't know in fact if the researchers are still alive or had been murdered from the last conflict, but we hope that blessing for all healthcare providers in Gaza and all people in Gaza from that. The study was nurses' knowledge toward hemodialysis vascular access device, cross-sectional study in Palestine, and they report that around 1/4 of the healthcare providers are having a wrong perception related to the general information about the vascular access devices. They have also unclarity regarding to the advantage and disadvantage, and this is in hemodialysis unit, which is one of the most important units in dealing with the VAD. So we can see how much the gap that we have it. Here, even like one staff can lead for a severe complication for the patient. So you can go here and think about what can happen and why that happened. So as infection control, what is our rules? What we should know? First, we should identify this area. Identifying measurement. What you cannot measure, you cannot manage, right? This is a principle in the healthcare. So we should be able to have tools for proper improvement and improving the patient care and the outcome and reducing the healthcare cost by proper procedures. And the first aspect of this one is to know the rate of the infection. Important area is measuring the rate, and the rate by identifying the infection rate related to the VAD, and connect this with the demographics of the patient, the knowledge of the staff, and the trends over time. Also, apart from that, it will give us a clue about where we are in the infection control prevention, right? Or where we are in the infection control situation. Are we able to say that, I am managing the hospital in the infection control perspective if I don't have data, right, about it? So this is important for us to know how we will measure the infection control rate and how the healthcare professions and the system can evaluate whether the strategies already applied useful for this condition and what are the area need for improvement regarding to the VAD. Measuring infection control rate can also be a benchmarking for the infection control in general about the standards, how much the compliance and the adherence, and comparing ourselves with others, with other peers. So we know where we are in the proper expected care. So it also will demonstrate, again, apart from the hospital vision, in the commitment to the patient safety, quality of care, and of course for the insurance companies and the cost. So important for us here to make quality indicator for the VAD infection, and apart important for us in calculating the rate, we should know exactly what we call it the patient days with VAD. So in every day, either by observation, physical examination, or by electronic medical records, we should know how many patients today we have vascular access devices, how many patients for tomorrow have an access device. Even if the same patient stay for 2 days, in this case we call it day 1 and day 2. So there are 2 days in 2 different days. For example, we have 5 patients, and still for the following days there are 5 patients, so the total of patient days with VAD will be 10, because every day we count what we call it the vascular access devices. And after that, we should identify the signs and symptoms that happen with this VAD. So what are the signs and symptoms? Fever, redness, swelling, and so on. This also can be identified by rounds, by the EMRs, by the incident report. Each hospital has its own way, but important to be identified, and start here to think about it as in terms of surveillance, so the data should come to you in the infection control. There are 2 steps we should be aware about it. First step is calculating the patient days, or what we call it device days. So VAD device days, and calculate the rate based on that. For example, let's say if a hospital has 10 vascular access devices, infection over 30 days period, and there are 1,000 vascular access device days inserted. So in this case, the rate 10 over of 1,000, so the rate is 10 per 1,000 device days. So this is how we calculate it.
Baby, you give me ice and fire. You're giving me wind and rain. You're some kind of butterfly. Baby, you give
Usually the cross-sectional analysis required here to know when, and this should be done in a period way. So for example, take at the end of the month, so we will calculate there this month how many devices get infection divided by the number of vascular access devices days, and based on that we come to conclude the rate. And this is, as we said, is very examples. See, for this example here, assume that a hospital has 150 central venous catheter inserted during 1 month period, and that 3 devices getting infection. So in this case, and each of these 150 stay for 7 days, so the total number of patients, the vascular access device days is 1,050. 1,050, so we will divide 3 over 1,050. Assume that the hospital has 93 peripherally inserted central line inserted during 6-month period, and 5 of these became infected. Calculate the VAD in the same way. How many vascular access devices are divided by these 5? So we will end by step 1, calculating the vascular access devices, which is here in this example, 2,800 vascular access device days, and then we will calculate the 5, divide the 5 over 2,800, which means for this example 1.8 infection on the vascular access device per 1,000 vascular access device days. Another example, let's say that we're talking about 75 central catheter, arterial catheter, it's also arterial, central line, and there are also 2 of these become infected. So in the same way, calculate the vascular access devices. Here in this example, 205 multiplied by, or 2 divided by 205. So the rate is 8.9. So you can see here the importance of having these records with us. Also, I will leave for you the third example, 500 central venous catheter. So the vascular access device is 10,000, and there are 12 infections, so 12 over 10,000, 1.2 infection for VAD per 1,000 days. So what I want to hear to say that important for us as how to do and keep going into vascular access devices. All, thank you very much.